The country has now adopted guidelines from the Centers for Disease Control, CDC, in testing and management of COVID-19 patients with mild to moderate coronavirus symptoms. Now, this group of COVID-19 patients will no longer be tested for a second time if they don't show signs of infection of the virus. Now, health officials say a number of people are no longer capable of spreading the virus after 10 days of infection. An additional 671 people turned positive today, with 3 COVID-19 fatalities recorded. Here now, details with our very own Elfas Lugad.
New findings suggest that a second test for COVID-19 is, quote, medically unnecessary. The Centers for Disease Control and Prevention, CDC, in a new set of guidelines, is advising nations worldwide that majority of patients are no longer infectious after 10 days. These findings, according to the CDC, are targeted for asymptomatic patients and those with between mild and moderate symptoms on self-isolation program. The Ministry of Health today announcing that it will no longer carry out second tests for patients falling in the category of asymptomatic, mild and moderate. These, however, excludes critically ill patients.
After your symptomatology, you don't have any fever and you're not using any fever-reducing medicines for the next 3 days. So after that, 10 days plus 3 days, without any symptoms, no fever, you don't need a retest.
An additional 3 patients died of COVID-19 today, pushing the death toll to 391 since the outbreak of the pandemic. The positivity rate today was 10.8%, of which 671 people tested positive for the novel coronavirus. The sample size was 6,200. Total caseload as of today stands at 23,873 infections, with Mombasa on a downward curve with 6 positive cases recorded.
633 of those people are Kenyans, while 38 are foreigners. 413 are male, while 258 are female. The youngest is a 3-year-old baby, while the oldest is 94 years old.
Health Cabinet Secretary Mutahi Kagwe, alongside Kenyatta University Hospital Board Chairperson Professor Olive Mugenda, unveiled a new 500-bed capacity infectious disease unit and intensive care unit facility that already has 30 ICU beds. The facility is expected to have a total of 60 intensive care unit and high dependency unit beds, with installation of an additional 30 within the next 2 weeks.
This facility will now carry 1,150 beds, out of which 150 will be for cancer purposes, and then the rest of it really committed to COVID-19.
The Ministry of Health announced a daily high in recoveries, where 603 patients declared as having recovered from the virus. Of these, 436 were in home-based care, while 167 were discharged from different hospital facilities. The total recovery is now at 9,930, while active cases are 13,552. A high number of recoveries, especially from the home-based program, spells good news for the country in light of facilities that are stretched from time to time. Elfas Lagat, Citizen TV, at the Kenyatta University Hospital.